Good afternoon, everybody. This is Aaron Warnham with the Montana Healthcare Foundation. Thanks very much for joining our 2015 Call for Proposals webinar. Today we're going to spend about a half an hour talking at you, and then we're going to take questions from you and do our best to answer all of those. We'll spend about 30 minutes talking and hope to leave nearly 30 minutes for questions and answers. Our goal today is to answer all of your questions and to try to make this application process as clear and simple as possible. We will also answer any questions that we don't get to on the webinar via an email to all of you at the end of the day. To ask a question, we're asking that you write them in using the Q&A function of the WebEx platform. So there should be a blue Q&A button at the top of your screen and a little box to type in questions there on the to the right of the slides. We will take as many of those questions as we can after we're done talking to you. We're also recording this webinar, and we'll send out an email with today's slides and a link to the presentation to everyone who's signed into the call. We're going to focus our presentation just on introducing you to the foundation, how we were formed, what we do, and how we developed our strategic plan. We're going to talk to you about the eligibility and selection criteria for grants from us. We'll explain to you our focus areas, what we're really particularly focusing this funding opportunity on, and then we're going to go over the nuts and bolts of how to submit an application. Again, we're really aiming to make this application process as user-friendly as possible, so we welcome questions from you today and throughout the application period. So just a little bit about the Montana Healthcare Foundation. We make strategic investments to improve the health and well-being of all Montanans. We have a strong focus on at-risk populations and health disparities. People who are particularly vulnerable to having poor health outcomes are a major focus of our work. We are the largest Montana-based foundation that focuses solely on health, and we're an independent private foundation. We're intended to be a permanent resource for Montana, so we manage the investments and the portfolio of funds that we have sustainably and make grants and grant-related investments of about 5% of the value of our trust every year. We were originally created from the sale of Blue Cross and Blue Shield of Montana in 2013, and this call for proposals is our first open call for grant proposals to Montanans. This year we plan to give more than $1 million in 1 to 2 year grants. It'll be somewhere between $1 and $1.5 million that we anticipate committing through this call for proposals. The maximum grant size will be $25,000 for a 1-year project and $100,000 spread over 2 years for a 2-year project. We anticipate that most of the grants we give will be less than $50,000, so that's important to consider as you choose the budget that you'd like to apply for. We have 3 major focus areas: behavioral health, which includes mental illness and drug and alcohol use, American Indian health, and what we're calling partnerships for better health, which is meant to be quite broad. You could focus on any issue that you feel important to the health of your community there, but with a real emphasis on the need for strong partnerships to achieve your aims. Our eligibility criteria are, first of all, we focus on Montana-based organizations. So we're not funding organizations that are not Montana-based under this call for proposals. We'll fund tax-exempt organizations, 501c3 nonprofits, tax-exempt educational institutions, and state, tribal, or local government agencies. Please note, though, that for the American Indian Health Focus Area, we also are asking that you either be a tribal government or an American Indian-led nonprofit to apply. Organizations can have partners that may be national organizations or may not be eligible to apply directly, but the primary grantee and primary applicant needs to meet these eligibility criteria. It's a long list of things that we don't fund here, and I hope they're fairly self-explanatory, but I'll go through them briefly. We don't provide grants to individuals. They wouldn't meet those eligibility criteria on the prior slide. We don't provide funding for major capital campaigns or fundraising events. We don't provide funds to correct operating deficits or retire debts. This year, we are not funding major construction projects or real estate acquisitions. It's possible that we will fund major capital projects, construction, and the like in future years. We don't fund organizations that discriminate. We do not fund any lobbying activities where forbidden to do so by IRS regulations. We don't fund political activities as defined in the Internal Revenue Code. We do not. Okay, we have a comment from folks that they can't hear us. Could other people let us know if you can hear us just by typing into the Q&A? Okay, it looks like many people can hear us. Thank you very much for letting us know. We're going to continue, and I'd suggest to anyone who can't hear us to probably try dialing back in. Again, this will be recorded, and we'll be happy to answer questions by phone or email if you missed part of this. So just continuing down the list, we don't fund large equipment purchases, so large medical equipment, vans, and the like. And again, that's something that we may reconsider in future years. This is focused on this year. We are not funding medical research or research that lacks a direct, targeted, practical benefit to Montanans' health. So for example, if you're interested in, you're working on developing a new medication to treat a disease, that's probably not work that we're going to fund. But if you're funding a project that is focused on addressing a specific health issue in Montana and will provide programming that addresses that issue, that's the sort of thing that we would fund. We are not funding organizations or foundations that would like to redistribute our grant money in the form of sub-grants. One thing I want to call out about the use of funding is that we are prohibited by law as well as foundation policy from using Montana Healthcare Foundations to supplant government funding. And I want to define that word for you. Supplant in state law means to supersede or replace. That is, if you have government funding for an activity, you are not allowed to use Montana Healthcare Foundations to replace those funds. You can use Montana Healthcare Foundation funds to add to or augment funding. So if, for example, you've already got government funding for a program, but you want to establish some additions to that work that would allow you to achieve specific new outcomes or deliverables that you couldn't do with current funding, that's something that we can consider. This is really intended to make sure that foundation resources achieve the maximum benefit. If someone that funds you already uses a grant from us as a reason to take away funds that they're giving you, then our funds don't have the maximum benefit. Our selection criteria are articulated very well on the call for proposals, and we hope that you'll read that in depth. I want to emphasize that these are the things we'll look at and score each proposal that we review according to. We'll be looking at the importance of the health issue that you seek to address. We'll be looking at the potential that our investment for a year or two will produce change that lasts beyond the grant term. And specifically, what are your plans if it's a new program that we're funding? What are your plans for continuing it? How would you continue funding? If it's another type of activity, what are the lasting effects that go on beyond the grant term? We'll be looking at projects very favorably when they create or strengthen partnerships and help use the sparse resources that many rural communities in this state have more efficiently and effectively. We will focus, as I said at the beginning of the call, on at-risk populations and programs that have a high chance of correcting health disparities. We'll be looking at the effectiveness of the interventions that you propose, i.e., you've got an important health problem and you've got a solution that appears to have a high chance of being effective. We'll also be, though, looking to make sure this isn't an idea that's worked well in Boston or New York City and has never been tried in a rural area. We're looking for things that are workable in Montana and culturally appropriate as well for the community that you're trying to work in. We'll be looking again at the feasibility and scale of the work. So if you're applying for $10,000 to build a new hospital, we might not think that that's really a realistic goal for a small grant. So again, looking at the scale of what you propose to do and making sure that it seems achievable with the grant the size that we can give. We'll also be looking across the grantee portfolio to make sure that we have a diverse portfolio, that the projects we fund are not going only to larger cities and urban areas, that they're also going to rural Montana, that they're not serving just one geographic region of the state, but that they're serving all of Montana. So again, I hope those are clear, and we're very happy to look at questions and see if we can answer more specific questions about these criteria. I'll talk to you just a little bit now about each of the focus areas. Again, if you're interested in applying in one of these focus areas and have additional questions as you begin to work on your proposal, we're happy to talk to you by email or phone. The first focus area is behavioral health. Some of the key challenges that we heard about as we did our strategic planning, looked at the data that's available, and talked to communities around the state includes a high suicide rate. Montana has among the nation's highest suicide rates and has for many years. Adverse childhood experiences, again, some of the studies that have been done suggest that adverse childhood experiences are more common in Montana than in many other states, and those have a lifelong effect on an individual's health and well-being. Driving under the influence and binge drinking, which leads to high rates of injury and mortality rates in Montana compared with many other states. A shortage of behavioral health providers in rural Montana. The challenges of funding behavioral health care, reimbursement and funding shortfalls are a huge challenge and a perennial challenge. Traumatic brain injury, post-traumatic stress among returning veterans, and we have a very high population of returning veterans, making this a very important issue. And also alternative high school students, students that attend programs in the public schools that are intended for a subset of students that have challenges, either behavioral problems, pregnancy, substance abuse, and the like. We found very, very high rates of problems like depression, substance abuse, and even attempted suicide in this population, and issued a recent report looking at the opportunities to address this problem through grants. So just a few examples of projects that we would consider, and these are areas that we found that seem particularly promising. We are really looking to hear from all of you, too, what sort of ideas you have. So in other words, you can apply for things that don't fall into these examples, but these are places where we certainly saw a lot of opportunity for investments that we can make to make a difference. Collaboration between mental health centers, health departments, hospitals, community health centers to strengthen the services and improve efficiency. It makes no sense to have 3 different facilities in a community all struggling to find resources and funding, all struggling to recruit personnel and not to have any collaboration among them. Jail diversion pilot programs proving very successful at reducing recidivism, reducing primary arrest rates, getting people with mental illness the care they need rather than putting them in jail, improving both corrections and behavioral health outcomes, while at the same time saving money on corrections budgets. A very promising approach, both for improving health outcomes and financial sustainability. Prevention and treatment for drug and alcohol use during pregnancy is a very, very high priority area. We heard again and again in communities, particularly rural communities, that drug and alcohol use in pregnancy is a big problem in parts of the state. And we also know that there are very effective programs that can help women get healthy during pregnancy, and would be very interested in supporting that sort of work. Pilot programs to address patients with dual diagnoses. Schools that are interested in applying for funding to develop behavioral health interventions for alternative school students or other at-risk populations of students. And partnerships outside the health sector that address upstream risk factors for behavioral health problems. So, for example, supporting housing for low-income populations, because homelessness can be a major risk factor for behavioral illnesses. Moving on to the American Indian Health Focus area, we heard many challenges in talking with tribal leadership, tribal health departments, and tribal community members, both in urban area and on the state's reservations. Some of the key challenges that we heard about are long-standing inadequate funding of the Indian Health Service, limited availability of drug and alcohol treatment programs, some of the challenges for young family born out of historical trauma, a lack of economic opportunity, and adverse childhood experiences, traffic injury, and again, the risks of driving under the influence and relatively low seatbelt use in some parts of the state, not limited to reservations by any means, but this is one of the causes of injuries and higher mortality on some of the reservations. Diabetes and obesity, which is much more prevalent on some reservations than the state statistics would suggest, and suicide and mental illness. Some of the opportunities and examples of projects that we would consider, and again, we are looking really to work with tribes and Native-led organizations to understand where the best opportunities lie. This is just a start at a list of a few examples. Helping tribal health departments strengthen their funding and establish stable and sustainable funding for their programming. So whether that involves helping tribes develop efficient Medicaid billing, helping them use Public Law 638 to the self-determination provisions to allow them to take over administration of some Indian Health Service programs, or other ways in which we can help with a small investment catalyze better revenue and more sustainable sources of funding for health programs. Health system planning, helping tribes identify their priorities and make a plan to figure out in future years what they could do to gradually build more sustainable programs that address the needs that they've identified. Projects that seek to improve maternal and child health outcomes, injury prevention programs, programs that strengthen our urban Indian health centers, which again struggled with the same funding problems that I described, but perhaps even more so in many cases. Culturally specific disease prevention, treatment, and wellness programs. We're very interested in helping tribes develop their own solutions to the problems and needs that they identify. This is work that we do intend to do with the communities that are interested, and again, we would hope to have a chance to talk with you and hear your ideas and hear how we can make these grants the most helpful to you. Talk a little bit about the last focus area, partnerships for better health. Some of the key challenges that we heard again and again in conversations around the state are limited access to health services in rural areas, workforce problems, that it's very hard to recruit and retain staff, and that funding can compound that challenge, again, often in the smaller rural communities, which really struggle to develop stable staffing and stable health services. Again, health disparities. There's a higher risk of illness among people at social and economic disadvantage, racial and ethnic minorities, children, and older adults. And rural health disparities are a major focus of this portfolio as well. Examples of projects that we would consider, again, just meant to be examples, not to pin you to only these ideas, but these are a few things that we saw that seemed to have a lot of promise. care coordination, so implementing care coordination programs and outreach, particularly where a pilot grant from us could lead to longer-term investment by the local health system. Patients that have complex medical needs, often referred to as superutilizers, there are evidence-based approaches that can improve their health outcomes, reduce ER, emergency room, and hospital use, and improve health outcomes, as well as saving money for payers and hospital systems. Collaboration between health departments, hospitals, community health centers, and mental health centers, so using scarce resources more efficiently by developing an interagency collaboration to address a key health issue rather than trying to go it alone. And partnerships beyond the health sector, looking at ways to improve health outcomes through addressing housing needs, access to healthful foods, school foods programs that would improve school nutrition, for example, and the like. So this is meant to be a broad portfolio, no specific health issue that we're focusing on, really just focusing on helping communities think about how, through a partnership, could we get where we want to go. So I just want to make a point in choosing the focus areas. You're free to apply for any area that you think might fit your project. We're guessing that partnerships for better health, because it's the broadest, might be the most competitive area. So given that, it may make sense to follow these suggestions. Organizations that want to focus on the health of Native American people and are eligible to apply in the American Indian Health Focus Area may want to start there and apply to that portfolio, because that has more restrictive eligibility criteria. So if you're eligible, it may end up being somewhat less competitive. Organizations that have a primary focus on behavioral health, even if you want to have a project that also involves great partnerships, again, may face a little bit less competition in the behavioral health portfolio than in the Partnerships for Better Health portfolio. And these are just guesses on our part, so you don't have to stick by this. Again, you're free to make your choice of whichever portfolio seems to fit your project the best. And finally, organizations that want to address issues that lie beyond behavioral health and American Indian health should apply in Partnerships for Better Health. Ted, you want to tell people how to apply?
Sure. We'll be using an online application process. It's pretty typical for those who have applied before with other foundations in the state. We're using a Montana-based grants application software called Fondant, which serves foundations all over the country, but it's nice to have a local Montana company helping us out. And so the primary way to access that for your first time will be through the Montana Healthcare Foundation website. There you can set up your user account, and then from there you can either save that to your favorites or access it on the home page of the Montana Healthcare Foundation in the upper left. And once you set up a user account, you can use that to apply for grants with the Healthcare Foundation throughout the next several years. It'll also be used for full proposals and periodic grant progress reporting. I'm going to go through a few slides just to orientate you to the application process with Fondant. It won't go in too much detail to the questions, but just help navigate through the different parts of the online application. So your login page, you'll access it. It looks like a Montana Healthcare Foundation website page. Actually, you're to a third party right now, so you're at a different website. And this will be first-time users must create an account, and then returning users, just make sure you save your user ID and login and all that. One caveat too is as you log in, you might get an email from Grants Administrator versus Montana Healthcare Foundation to confirm your login, so make sure you check your spam filter and things like that, because you might get a email from Grants Administrator, but that will confirm your account setup. As you can see on the login page, we give a few instructions there. And then from there, you'll go to our application page, which this is where you'll choose your area of focus, and you can choose one of the 3 letters of interest, as Aaron described. And just click on the blue title bar there, either for American Indian Health, Partnerships for Better Health, or Behavioral Health. And that'll take you into a specific letter of interest application. Stepping through letter of interest, you can see there's 5 main areas. We'll be just looking at your organizational information, your project title and summary, some demographic information and region, what area of Montana you'll plan on serving, project description, and a project budget. For the type, you can just see selecting your different types, what the funds will be used for, and making sure you acknowledge that these will not be used for things we do not fund, and also that they will not be used to supplant government funds. And then jotting down your organizational mission. Next, on to the project title and summary page. This will be a chance to just have a brief description of your project title and then what the project hopes to accomplish. From there, we'll go on to the demographic information. You can see what areas of the state there will be a map to link to so you can confirm the geographic area, demographic information of the populations to be served. This will help make sure we are funding organizations from all over the state of Montana, especially some of those rural pockets that we're trying to reach. On to the project description. There'll be a couple sections of this. And again, as you fill out this, make sure that you keep the selection criteria in mind of what we're trying to accomplish here in our areas of focus, what we'll be looking for in these different descriptions of project activities and the impact of the project. Also, we really will stress the partners, what partners will be enlisted to successfully implement the project, and then sustainability. What are your plans after the project grant term to keep it going? And then the project budget, just what term you hope to be funded for, any other matching support, in-kind support, and then an organizational budget as well. And again, applications will all be online. There is a chance in there to do a PDF of all the questions if you want to put it into a Word document and then cut and paste it into the online application. You can do that as well. So there is an opportunity in the Fondant system to print out a PDF and have those questions all in a PDF format. Thanks.
Okay, thanks so much, Ted. So just to summarize the timeline, letters of interest are due on June 30th, and that's the process that Ted just showed you what the letter of interest online application system looks like. We really do hope that'll be simple for people to use, but please, 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 if it's not, if you have any trouble, you can get in touch with us and we are here to help. July 15th, we'll be making decisions on the letters of interest and inviting full proposals. So we aren't making funding decisions on July 15th. We'll be inviting full proposals. September 15th, the full proposals will be due. Sorry to make some of that fall over summer vacation, but we hope that we give you enough time to get it done. And again, we're trying to make this as simple as possible, so we will try to not make the full proposal process too onerous. October 15th, applicants will be notified of final funding decisions. And we anticipate that projects will start in November. Sometimes there's a little bit of a grant negotiation process, or if we're working with a county government, they may need their Board of Supervisors to sign off on receiving the grant, so it may be a little later than November, but our target date is for projects to start in November. So that concludes our talking at you. We are going to now answer your questions. Some of you have typed in questions. We'll start with those, but please continue typing your questions in, and we will do our best to answer all of them. Again, if we don't get to all of them before our time is up, then we'll go ahead and post the answers to the remaining questions in an email. Okay, so what questions do we have?
Okay, so our first question is funding considered supplanting if the federal and or state source has already dried up?
That's a great question. So one thing to point out for everybody on the line is if you look in our frequently asked questions under the planting, there's a little bit there, and then there's a link to a 2-page document which you all should read that goes over the planting. I don't think we answered this question in that document, though, so I'll do my best to answer it now. I don't think so. It sounds like if you had a program and your funding is gone for it, we aren't replacing funding. We would really be providing new funding for a program that used to exist but no longer does. So I hope that answers. We'd have to probably look at the specifics, and again, we're kind of under the magnifying glass on this one because there is a state law that prevents supplanting government funds.
Our next question, does the grant need to have matching funds? If so, cash or in-kind or both? And how much matching to grant funding?
So it's not a requirement that you have matching funds, but we do, however, in the short budget section in the letter of interest online application, have a section where you can enter any in-kind funds. So in-kind we would consider to be contributions of existing staff that you would be devoting to the project, or other grant funding or other sources of funding that would also contribute. We think it will play into the way we evaluate these projects, not because we expect a certain level of match, but because it has to do with the feasibility and scalability of the project. Can you really get done what you're proposing to do? If it's a big, ambitious project and you're applying for a small grant from us, what other resources do you have available to accomplish it? So I would think of it as something that can strengthen a proposal, but there is no specific requirement for either in-kind or matching funds.
Can an organization apply for more than one grant if applying under different priorities?
Yes, organizations can apply for up to 2 grants per organization. Again, though, remember that we are looking for a diverse grantee portfolio and we're aiming to support projects around the state. So it's fairly unlikely that one organization would be awarded more than 1 grant. We haven't made that a strict prohibition either, but I expect this to be fairly competitive, and because of that diversity selection criterion, you can apply for up to 2. It's unlikely that you would be awarded 2.
Can one agency request funding for multiple diverse projects?
So I think that's pretty much similar to the question we just answered. Again, one agency can apply for funding for up to 2 projects, and just because of our geographic diversity selection criteria, it is relatively unlikely that you would be awarded funding for both.
The question of eligibility. Are national nonprofit organizations that have a local Montana chapter eligible?
We are actually still looking at that question, and we'll give you a final answer by email. This has come up a couple of times. When we said Montana-based, we basically intended that these would be organizations that really have a strong focus in Montana. We recognize that there is potentially some ambiguity there, and so we are working on an answer to that, and we will post it on our frequently asked questions and send it out to this group after the webinar. So here's a question. Do you have statistics for counties? And I think, was this a question particularly focused on behavioral health statistics? So one piece of work that I do want to let everyone know about, we've made one grant in 2014, which is funding local health departments and tribal health departments around the state to do a lot of health planning. Health departments that haven't done one are receiving funds to do community health assessments, which will generate county-level health statistics. This is also a partnership with the State Department of Public Health and Human Services. And with them, we are working on helping make sure that each county health department and tribal health department that wants to participate in this has county-level statistics. We're expecting that those profiles, county profiles, will be released sometime in the next several months. It's very exciting. I think it'll be a real tool for people interested in understanding the health of their communities. And the profiles aren't quite ready yet, but we're hoping that those will be released over the coming months.
When will the LOI process open, and or when will the LOI specific questions be available for review?
So the LOI process is open now, and if you go to our website, which is www.mthcf.org, and look for the current grant opportunities, you'll be able to trace that and get to the letter of interest online application system that Ted showed you.
Will you give equally to the three main categories, or will you make that decision once all the proposals are in?
We envision this as aiming for roughly equal amounts of money in each portfolio. However, because this is the first call for proposals we've done since being created, we aren't sure what we'll get. So we will make the final decision on the balance there based on how strong the proposals are in each. I would say that it's also important, though, for people to recognize our focus areas are not just for this year. We will not be turning away from behavioral health or American Indian health next year. So this is really just a start. If we don't end up funding quite as much in one portfolio as in another this year, we'll also be looking to the future to how to strengthen programming in each of our major focus areas.
Our next question is, if an organization has a national presence with chapters throughout the state, is it recommended that only one chapter apply for all, or should each one apply individually?
I think to give you the best answer, it might be better to have that conversation to understand a little bit more about your organization. But I think we've talked, for example, to universities who have a number of different departments. At this point, the best advice we've been able to give them is to treat yourself as a single entity and to consider 2 proposals the maximum that you can submit. We'd be happy to talk offline, though, if that doesn't fully answer your question. Do you include county and criminal justice systems as collaborators? The answer is a resounding and definite yes. We think that county criminal justice systems are a phenomenal collaborator. The work that I mentioned with the jail diversion programs is being done through collaborations between the mental health system and county correction systems. That's one example of many that I can imagine. So absolutely yes.
Is there a scoring guideline for the LOIs?
The best guideline that we can refer you to is the selection criteria themselves. We will not rely solely on numerical scores, but each of those criterion will be evaluated and needs to be spoken to in your proposals.
The next question is, might I ask how the allocation of project areas was determined? It seems like this is not much money for the scope of the problems. For example, with regard to behavioral health services, does the call for proposals align with any public health goals or other?
The best articulation of how we arrived at these focus areas is in our strategic plan, and I would encourage everyone to read the strategic plan. We developed our focus areas and strategic plan and this call for proposals through an in-depth process that's taken place over the last year. Our trustees and the staff of the foundation have spent countless hours poring over all of the available data at the state and local level, reading both published and unpublished studies that have looked at how best to address the prevalent health issues. We've spoken with stakeholders around the state, both health experts, hospital leadership, hospital staff, county health departments, tribal leadership, nonprofits, universities, and many others to get a handle on not just what are the needs, what are the prevalent health problems, but where are the real opportunities. the question also speaks to the size of the resources, and that's a very important point. I've never actually seen a statistic on how much we spend in the healthcare system annually in Montana, but if you look at national statistics, it's estimated that on a per capita basis, the nation spends between $7,000 and $8,000 per person per year on healthcare. You translate that to Montana, that could be as much as $7 to $8 billion a year on healthcare. From that perspective, $1 million, $1.5 million is a trivial amount. My experience from working with foundations for many years, though, is that these funds are not trivial because they're doing something very different. They're allowing people to take 2 steps back from their daily jobs of running a hospital or running a health department and think, what can we do differently? What can we do that's new? And how can we leverage this small amount of funds, for example, to develop a new, larger, more stable source of funding, such as helping a tribe utilize Public Law 638 to take over its funding from the Indian Health Service. and that can then translate into many, many more dollars than the size of the grant that we're offering.
Would applying to more than one focus area be better for programs that fit into more than one focus area equally?
I think it makes sense to submit one proposal to one focus area. In other words, I wouldn't advise that you submit the same proposal to 2 focus areas. It'll be all the same staff and all the same trustees that review these proposals, and we will, I think, be looking across each of the 3 focus areas to see where projects seem to fit the best. Our real goal is to reach into each of those focus areas in a substantive way and make a difference. And so I think, how you choose the focus area is probably ultimately going to be a little bit less important than just submitting a very strong proposal. Does anyone else have any questions?
Got one more. May one member of a collaborative partnership apply for funding on behalf of a multi-jurisdictional team and serve as a fiscal agent for a project that would impact a number of different communities?
Absolutely. We anticipate that there will be a lot of proposals to this opportunity that involve multi-agency partnerships, but we're only going to fund one of those agencies as the primary grantee. In your budget, you'll end up, not in the letter of interest stage, but in a full proposal, in your budget you'll describe how would those funds be divided amongst your partners. You may have subcontracts, for example, and that's perfectly acceptable. Okay. Well, it sounds like some of you had some trouble with echoes on the line. Again, this is our very first webinar. We'll see if we can figure out what the problem was, and if any of you would like to sign in for the next one. Melinda, do you have the date and time for that?
Yes, it's going to be May 12th at 2 p.m. And like I said, if you had any problems, please let me know so that future webinars we can make sure that we fix those.
Yep, and again, if you didn't get your questions answered today, we welcome emails or phone calls. At this point, we're a very small staff, but we will do our very best to answer any of your questions however we can. Any more questions? We're a few minutes early, but we can shut down the webinar if there are no more. Okay. Well, thank you everyone very much for joining this webinar. One other thing to point out is that we will be having a phone call, a conference call for people interested in the tribal focus area, just to go into a little bit more depth on that area for anyone who wasn't able to join today. That call is on May 14th, also at 2 p.m. Please contact our office to sign up for that call because it's going to be a little bit smaller, not a webinar, just a conference call. And there were just a couple of final questions. I will be emailing the PowerPoint out to everyone, as well as any
additional questions that we get. The May 12th webinar is a repeat of today. It's just for people who weren't able to make the call today. And then we have one more question, I think, for Aaron. Is there a cap on indirect costs?
It looks like there are two more. So, yes, the cap on indirect costs is 10% of the total budget, Ted? Or
no, 10% of your personnel budget.
10% of the personnel budget. Okay, and finally, will the tribal call include service to urban Indians? And the answer is absolutely yes. Everything about this call for proposals is intended to serve the state's urban and reservation-based Indian populations, federal and state-recognized tribes as well.
And then there's another one. If one agency applies on behalf of a collaborative partnership, would that compete internally if the agency would like to apply as a standalone project?
So I hope that I'm understanding this right, and if not, please send us a follow-up email. If I'm interpreting it right, you're saying that this organization would submit two proposals, one on behalf of a partnership and one on behalf of its own agency. Again, it's a little bit hard for us to know that, you know, the geographic diversity criterion that I've mentioned several times is important here, but I think if you can show how those two proposals differ in terms of the organizations that will be receiving funding and the geographic areas that they serve, that those could both potentially be competitive proposals. Okay, well, we've gotten a few good ones here in the last few minutes. So I think we'll keep the line open for another minute or two, just in case anybody else has any more questions. Thanks so much for a great discussion. Okay. Okay, I think we're going to go ahead and end the webinar now. Again, really, thanks so much for being on the line. Do not hesitate to call us. We're here to help. This is our first call for proposals, so we aim to learn an awful lot from all of you about how to make this as helpful to your work as possible and as simple a process as possible. That's our goal. Thanks again.